A fantastic presentation from Dr. Robert Lancey, MD of Sentara RMH. Uh, he is speaking on healthcare professional burnout and care impact. And you can tell that he is truly passionate about this subject and very insightful. Dr. Lancey attended medical school and completed his 2 residencies in general surgery and thoracic surgery at the University of Massachusetts. Following a cardiac transplant fellowship in England, he served on the staff at the University of Massachusetts for 10 years, where he established both the off pump cardiac surgery program and the cardiac surgical transplant program. Dr. Lancey started a new cardiac surgical program in the Bassett Healthcare System in upstate New York, where he served as director of Bassett Healthcare Institute and was appointed chair of quality management and network medical director in the Bassett system. He also held an academic appointment at Columbia University. He transitioned to Virginia in 2013, serving as medical director of the Bon Secours Heart and Vascular Institute in Hampton Roads and chief of cardiac surgery for Bon Secours, Virginia. And now he is with the Sentara Rockingham Memorial Hospital team. Dr. Lancey earned his MBA from Cornell University in 2007. And again, he is clearly very passionate about this topic and an outstanding speaker. Thank you very much, Dr. Lancey.
So I want to take the opportunity to thank this group for allowing me to present on this topic. This is a probably, it sounds ironic to say it, burnout, but a favorite topic of mine, and I'll explain why in a few minutes. Pretty fascinated by this and what's going on in healthcare over the past couple decades with burnout. I think that what we've seen so far over the past couple decades in, probably even accelerated by the COVID-19 pandemic, are changes in the work environment in healthcare, and that's had some pretty significant impact on employees and workers, our fellow workers, and probably many of us. I've had an opportunity to read a lot about this topic in the past 15 years when I started to become interested in it. I've given some presentations nationally on it and written about it. And I will tell you that it's a work in progress. The original presentations that I developed 15 years ago are different in many ways from what you're going to see today. And I hope that through this, you'll gain some understanding of just what's going on in healthcare, because I think personally it's a great field, and I feel blessed to be able to be a physician and be working in healthcare for my life. So what I'm going to do today is talk a little bit about the concept and causes of burnout, some of the signs and symptoms we see in other workers and in ourselves in terms of burnout, and then appreciate what impact it has, not just on us, but also on patient care. And then, sort of brainstorm a little bit on some strategies for preventing, and I won't say treating it necessarily, on our level. That's others we sort of reach out to for that, but in addressing it and how we can impact it just in our daily lives at work. And then to recognize, we'll close with by, recognize a little bit of impact the pandemic has had on burnout, which I find fascinating. There's actually been a lot written about it. I have my own attitudes about what it's done. I think in some ways it's actually had a positive impact in terms of as healthcare professionals, how we feel about ourselves, and the amazing work that the healthcare community has done over the past year, confronted with something that none of us ever anticipated and had prepared for. But at the same time, it's taken its toll, as we'll talk about. As with any talk I have to present, I have no financial interest or conflict of interest with this presentation. So my journey in this began back in probably about 15 years ago. I was the network medical director for a large healthcare organization in upstate New York, and Doctor's Day came rolling around just around this time of year. I think it's March 31st, I believe, or the end of March. And they asked me as network medical director would I make a presentation to physicians. So I started looking at on the internet and reading about what's great about being a physician. And I was very surprised to find out that there was a lot negative about being a physician, because I had always, again, I feel blessed to be able to do what I do and interact with patients, and have always just thought this is the most wonderful career I could ever have dreamed of. And yet, what I found is that a lot of people weren't so happy with medicine. So I started looking at, what are some good jobs? What are the top jobs? And I came across what was listed as, the top jobs of 2011. And here's what I found. we weren't even in the top 10 as physicians. We were down around number 83. And I think for any of you who have, know physicians well, it's sort of like cats and dogs with lawyers. My brother's a lawyer, but we get along pretty well, which is amazing as a doctor and a lawyer. But I think it was more of an insult to be one step below lawyers and not so much being number 83 in terms of what the top job is. And I want to just point out that when you look at these rankings, you look at how they rate us, and they look at the work environment, they look at the stresses you face at work, the physical demands, and the hiring outlook. And physicians in general practice were only number 83, which I found to be astounding. And furthermore, if you look at further down the list, 92 as psychiatrists, nurses were 94. I think the only thing that nurses can take a little bit of solace in is that their work environment is slightly better than that of a sewage plant operator who's down around 700, whereas our work environment rates as nurses rates 1,000. And then I think the worst part is, as a surgeon, we didn't even make the top 100. We had a great work environment, they say, and a lot of stress, but actually less stress than that of an insurance agent. So, you got to wonder about this a little bit and take a perspective on it. And I think it's fascinating that the work environment was thought to be so good, because as we talk about burnout over the next hour, you're going to see that a large part of this is due to the work environment. So we sort of fast forward to 2016. I'm hoping things looked a little better, and I went and looked at reports then, and I found that physicians are still not even in the top 50, down around number 77 in terms of work environment and stress and whatnot. Surgeons, again, up into the top 100, but not much higher, down around 90, for one step above a stenographer. So then I'm starting to say, well, maybe this profession isn't as great as I feel it is to others. Others may see it differently. And what I indeed did recently, getting ready for this talk, was look at the top 100 careers in 2021. And lo and behold, you look at all the ones in healthcare, nurses, pharmacists, physicians, physical therapists, occupational therapists, and so on. And now the ratings are much higher. But I caution you, these are not about work environment and stress, but these have to do with a rating scale based on salary and rate of employment. And being in healthcare, we're very lucky. I don't know if many of you know this, but healthcare was the one industry in this country that during the recession, a decade ago or so, actually increased jobs and had some stability. Every other profession and every other industry lost jobs. And I think we've been very fortunate in the pandemic in a way, in that many of our friends and relatives have lost their jobs. Unemployment rates are sky high. Government loans to keep, people even just having food on the table, which is tragic, have been necessary. And yet in healthcare, we of course have played a major role in fighting the pandemic. And, it just shows, I guess we used to, you can't outsource a haircut or a surgeon, so we have the ability and the fortune to have been able to be in a profession in which we can not only help others, but, we can help our families by staying in work. So what is burnout? Burnout is fascinating subject if you think about it. It was the term was first coined by a fellow named Herbert Freudenberger back in the 1970s. He was a psychologist who was working in inner city drug treatment programs in New York City, and he was watching the volunteers and what was happening to the volunteers, and he was seeing that they were dropping out in what he called burning out, that they had a state of mental and physical exhaustion caused by their professional life. It wasn't what's going on at home, it was what was going on at work. And it was a result, he thought, from having high ideals and yet severe stress. I can relate to this a little bit because back in the 1970s, I actually had finished college and decided that medical school would be in the future. And I took several years off wondering if I would even go to be a doctor. And I worked in a drug treatment and prevention program. And I remember the boss, the head of the program, coming in one day after a couple of years and saying, you're doing a great job, but be careful. You're really diving into this. And I've learned myself that this will take its toll on you in the future in terms of, he didn't use the word burnout, but in terms of sort of the physical and mental toll it takes on you. And so it was a problem that was recognized back then. It was more formalized by a woman, Christine Maslach, who out in California was a psychologist, and she's done the major brunt of work in burnout. And she defines it as a syndrome that occurs among individuals who do people work of some time. And she has developed burnout inventories and tests for educators, healthcare workers, people who are in helping industries. She found that there were three characteristics of burnout, and she categorized them into emotional exhaustion, depersonalization, and a sense of reduced personal accomplishment. I want to just elaborate on these a little bit, not to get too technical, but emotional exhaustion really is just devoting excessive time and effort to a task that's just not perceived to be beneficial. You get emotionally exhausted, and I think we've all been there. And I want to emphasize that burnout is not a switch that turns on and off. That Monday you're not burned out, and Tuesday you are burned out. That burnout is more of a continuum of a condition and a situation where some days you have a lot of fuel in the tank, and other days you just don't have anything there. And you're not, I wouldn't say necessarily you're burned out one day, and this is my personal opinion, you're burned out one day and you're not the next day, but it's generally just this path that you go on. And I used to do a lot of hiking, and I liken it to hiking in the woods when I'd almost get lost sometimes and not even have a goal in mind of where I'm going to stop and camp at night and doing backcountry camping. That you just sort of go along a pathway, and all of a sudden you look around and say, wow, this is either a beautiful area, or wow, I think I see some bear footprints here. I better be a little cautious. Burnout is a condition. I think it's a condition that we sometimes slip into and not even know about it. But again, one of the hallmarks of it, and I think probably one of the most common conditions in burnout, is this emotional exhaustion, where to me it's again feeling like there's just nothing in the tank. You're sitting at the nurse's station, and you've got 2 hours left in the shift, and someone drops by and says your patient in such and such room needs this, and all you can do is just drop your shoulders and think, I just can't take this. That's some the way that people get emotionally exhausted. The second is depersonalization, and this is an area where people tend to get very cynical and callous and negative, and just sort of feel like this is just not working. This is not who I am. This is not something I'm comfortable with. I think the third area is something that, in particular for physicians, can be pretty tough, and that is a reduced sense of personal accomplishment. You just sort of look at yourself and say, I'm just not doing the right job. I'm not doing a good job. I'm not doing what I want to be doing. And all of these three sort of mix into a bowl and come out, and when they reach high levels, they can tend to make someone feel burned out and actually be burned out. Again, they don't exist in isolation. People often aren't emotionally exhausted without things affecting them. And you can see here that emotional exhaustion can tend to make you feel less omnipotent or less able to conquer jobs and conquer tasks. For physicians, it's the feeling that I'm just not doing a good enough job for my patients. And you get this reduced sense of personal accomplishment. Emotional exhaustion can also make you feel resentful, that you have nothing in the tank, you don't have enough energy to take care of patients, and you start to resent patients and become a little biased against them. Those feelings themselves subconsciously make us feel inadequate, because we're supposed to be givers and healers, and we're supposed to be completely dedicated to our patients and never feel resentful to them. So all of these, again, mix in together and can potentially cause burnout. Also, again, thinking about burnout as not existing in isolation, it's a continuum. We talk about engagement, and in hospitals we get engagement surveys. How engaged is the staff? It's a measure for the administration. How are we doing? Do we have people engaged? And engaged employees tend to be energetic. They're involved in work. They want to take on more tasks. They're pretty efficient in how they approach things. And I think we've all seen that. I think we've all been engaged tremendously at times, particularly when we first start out a job. And you see fellow employees who come in. I think one of the great one I see is that when I go on the wards and see patients, we'll sometimes have nursing students there, and they are just raring to go, and they're eager, and they want to learn, and they just want to jump in and learn everything they can about a patient. And other staff, it becomes a job sometimes, and not to say we get less engaged, but we lose some enthusiasm, we lose some of that energy, and it can continue along a continuum, progress to the point where not only we're not energetic, but we're just exhausted. We feel overextended. We have really no emotional or physical resources left. We get less involved, in the organization. We don't see ourselves as much as a member of a team, and it becomes for some just survival to get through the day. This can produce a cynical or a negative callous effect, a detached response, and pretty soon, we enter sort of full-blown depersonalization. And in terms of efficacy, how many of us have ever done something that we've done with patients that felt like maybe we could have done a better job, and we didn't do our best job with that, and that makes us feel very incompetent. People in healthcare are very high performers, and we all want to do well. I always would say that in managing quality, that no one walks in the door in the morning wanting to do a bad job, but sometimes wrong medicines are given or specimens are labeled wrong, and we have to look at the system and see how we can make the system better, because it's not individuals. People don't come to work trying to do a bad job. But when those things do happen and we don't do as good a job, it makes us feeling incredibly incompetent and feel like we're just not as good as we thought we were. And Maslow defined it so well, and I have her quote at the bottom: what starts out as important, meaningful, and challenging work for some becomes unpleasant, unfulfilling, and meaningless work. Going back to Freudenberg, the psychologist who worked in New York City, he defined burnout in 5 stages and how it progresses. And he described the first stage as a honeymoon phase, where people are energetic, they're enthusiastic, happy, and creative. They're optimistic, productive. I think we all start off in jobs like that. And then sometimes, without good coping mechanisms, stress can come on. And if we don't know how to handle stress, it can make us feel temporarily fatigued and irritable, give us, make it hard to sleep. Productivity goes down a bit, but then, we get home, we bounce back, we go on vacation, we come back, we're enthusiastic, and we're back in stage 1 again. But for some people, this stress is overwhelming, and it becomes chronic stress and entering sort of stage 3, always tired, always withdrawn, becoming apathetic and cynical. And then stage 4, which is burnout. And I think, and they look at studies across the country, and they talk about, upwards of 2/3 sometimes of healthcare workers in different fields are burned out at one time or another. And again, I don't see burnout as, once you hit burnout, that's it, you're done, you're cooked, you're burned out. I think there are some days that I've read about this stuff, and I think some days I feel burned out for several hours or even a day, and then go home for a weekend, do stuff with kids, and bounce back Monday, and you're raring to go. The problem becomes down here in stage 5 with habitual burnout, and people become chronically sad and physically exhausted all the time. Mental fatigue sets in, depression, substance abuse, even suicide. This can be a real problem. So this is a continuum again, and I encourage people to look at it that way, that burnout can be something that we feel sometimes and we bounce out of it. You can see it in fellow employees. But the folks that are down here in stage 4 and 5, those are the people that when we see this happening, we need to step in. We need to help each other out. And I'll talk a little bit more about that as I go on in the talk. So again, I think the cascade really starts here. That if you don't have good coping mechanisms, good social support, you don't have any control over your stressors, and you have what I call gaps and imbalances, which I'll talk about, what can be a stressful day can turn into be 2 or 3 stressful days in a row, and then several stressful weeks, and pretty soon, you're heading down to some pretty dangerous areas down below. So the stages that people tend to go through, the early phase symptoms of burnout, interestingly, are reflected by increased commitment to goals. We're high performers in healthcare, and when things start to not go right, we often don't drop off easy. The saying, when the going gets tough, the tough get going. That's so true of people in healthcare. You throw barriers in, you're at a bedside, patient has to go sour a little bit, and what do? You don't walk away and say, I can't deal with this. You dig in, you call for some help, you get that patient, treated well, and you get them through that problem. If not, you get them to the ICU, they work hard, they dig in harder. I think that's some of the problem we've had with COVID-19, is that despite our best efforts early on, we were losing a lot of patients, and that can be devastating to healthcare workers. And I'm going to, again, come back to that a little bit. The second stage becomes a phase of reduced commitment. You don't have a lot in the tank. You lose a lot of energy. There's less to give to patients, less to give to work and family, and you start to feel overwhelmed. And I think, some days, some of us have always felt to a degree overwhelmed, but this is more of a chronic feeling that it seems to happen every day, that you just can't seem to get through the day without feeling like, to yourself, is this the right field for me? And then you get into these emotional reactions and blaming, and I think we see this in others, that they may act out a little bit, or conversely, they may withdraw into depression, and they become less social with us and less eager to give a smile or a wave hello. And you sort of look at them and say, wow, they're just sort of going through the motions. What's happening with that person? We always, I think in healthcare, we look at it and say, oh, it must be something going on at home. And a curious thing for physicians is that, which has been a kind of a challenge, I think, throughout the the tradition of the profession is that when we see impaired physicians, we often turn the other way and don't reach out to them. And part of that becomes the idea that, we're autonomous and we don't want to step on other people's toes. But it has bred in the field of medicine for many, many decades an inability to sort of confront this and deal with it, which is ironic when you think of it. We're healthcare workers. We're here to take care of patients, but in general, take care of people. And when we see these things happening in our fellow workers, we tend to turn the other way and walk away, which is just tragic. And I'm hoping that this opening people's eyes about burnout will help to alleviate some of that. And finally, we end up in the fourth phase, which is a noticeable reduction in performance, that we can see that, the creativity, the clinical judgment, and the motivation to work are disappearing in some of our coworkers. Some of them get psychosomatic complaints. They're out a lot of absenteeism. And I think I sort of sum it up with this quote I have at the bottom of my own, which in many ways it depends on the pre-existing personality and coping skills that we all have. Some exhibit burnout by working until they're exhausted. Some do it by withdrawing. Some become cynical, and some don't show any signs at all. They just, they just go through their days. They withdraw. They hate their job. They make it through each day, and they get up in the morning and drag themselves to work, which I think is just tragic. So I think a lot of what burnout is related to energy. We become to a point where we lack physical energy, fatigued all the time, no time for family, no time for anything outside of just getting to work and getting through the day. A shortage of emotional energy. It becomes hard to become compassionate and empathetic to patients. I faced it myself when I've been, extremely busy and, running around clinic, and they call and say, well, we want to add on a patient to your clinic. It's Mrs. So-and-so who's been in 3 times in the past month complaining about a problem that you've investigated and really there's nothing that can be done about it, or it may be psychosomatic. And there isn't a physician that says, oh, great, I want to see her again. There is some resentment to that, but, you pick it up and say, let's get her in there, and you walk in the room and sit down and you become compassionate and and link with the patient. That's the part of the beauty about being in medicine, is being able to do that and to pull that extra energy out. Some people don't have that. Some people don't have that extra energy to pull out, or as I think of it, sort of the extra fuel tank. And then there's ambiguous spiritual energy. And I think this is a real key thing. I've encountered physicians in my role as a physician leader in the past who have shown evidence of burnout and have just been, acting out and all. And I bring them in and tell them, look, don't worry about how the hospital's doing. Don't worry about the finance. Don't worry about any of that. Do what you love doing. Go be with patients. I've worked with a physician before who really wanted to move into administration and yet couldn't interact with people that well on the administrative level and would lose his temper and just not fit in well. And he was distraught because he saw himself as being a leader. And I said, well, what do you love doing? He said, I love being with patients. I said, then what the heck are you doing trying to be an administrator? Go do what you love doing. Go sit with your patients or operate on them or do what you love doing. Because this idea of this calling of medicine, I think, is just tremendous. We're so lucky to be able to interact with our fellow people in our community in a healing role. And if that's what really drives you, that's what you should be doing. So what you might feel like if you're experiencing some burnout, feelings like you're stuck in the situation that, there's no other career for you. You have to do this career and you sort of have to drag yourself to work every day. A feeling that you're not as good as your job as you used to be, that you're having a lot of doubt about what you can do. The job becomes all that you think about. You go home, you bring it home every night. You talk about it. You talk about the people at work, people that are sort of like a pebble in your shoe that get to you all the time, and it just becomes all consuming. I know my own wife had a job that she took for a while that it became all consuming, and from the minute she got home until we went to bed at night, it was all talking about work, and she just didn't realize it was just getting to her. And finally, what this will lead to, it actually is a sort of cause and effect. As you get more burned out, there's more conflict at work and home, and that in itself accelerates the burnout because that's sort of our pop-off valve. Our kids and our families are our saving grace, I think, sometimes in healthcare. And when that's not working, things kind of fall apart. What you might see in others or what they may see in you, that you're constantly fatigued. You see someone who comes in the shift and they look exhausted walking in the door at 7 a.m. and you've got a 12-hour shift ahead or an 8-hour shift ahead. people display resentment or they act out. We all will, in a corner complain about this or that, whether it's fellow workers, administration, or even sometimes patients. But people that do it all the time and do it, verbally out there for everyone to hear, that's when you start to think, is there something going on more than just, the pebble in the shoe or stuff that's bothering you each day, lack of supplies or whatever. There seems to be a lack of enthusiasm for work that you'll see, or a lack of professionalism, people sort of going through the motions. And one that I find fascinating, I had always seen it, but I had never seen it codified, and I read an article, they talked about this. They become very intolerant of change. You see a schedule change or policy changes, and it just seems to set them off. Like it seems to be one more thing, and what's going on with this organization, they're just not doing things right, instead of just, riding with the punches that we all do, and we seem to get through our days doing. And for those that used to be outgoing, they can become more introverted, both toward patients and toward staff. So is this a real problem? It definitely is. The incidence of burnout, in physicians is over 50%, and in some studies up in the 60s and even low 70s. It's also the case in nurses. I found this to be amazingly low in the study, showing only a third of nurses with burnout, because I think the incidence is much higher. I think in many ways, nursing is much more difficult than being a physician. And although, again, about almost half will report some degree of emotional exhaustion. And then, of course, the pandemic hit, and that has set things off even more so, and I'm going to get to that in just a short while. This is a study that was done by arguably the country's expert on burnout, and that is a guy named Ty Schonefeld, who was at Mayo originally, is now out at Stanford as their chief wellness officer. And he was the first physician who really started studying burnout back about 10 years ago. And he did some surveys at Mayo and found out that the symptoms of burnout, in at least one symptom was almost in 45% of the physicians, and within 3 years had gone up almost 10 percentage points. And interestingly, the balance, having a good, healthy balance between work, schedule, and family, had dropped by almost 10 percentage points. And this is, burnout is not endemic to physicians. Not only people in healthcare have burnout, but it's interesting that, such a significant amount of the workforce, both physicians and otherwise, have significant burnout. If you look at it as this study that compared, that of physicians to the general population, physicians obviously working harder and a greater percentage, almost 50% working 60 hours or more a week, but almost double the percentage of emotional exhaustion, much greater depersonalization, and many, many more with symptoms of burnout. And conversely, much fewer with a satisfaction between work and life. So yes, burnout does occur in others, in particularly in service industries, teachers in particular. But in healthcare, and for physicians in particular, the rates are exceedingly high, and it leads to another problem in that 300 to 400 physicians commit suicide each year. Female physicians committing suicide to 130% higher degree than females in other professions in the country. So this does have obviously some drastic and tragic ramifications down the road. So what contributes to burnout? I think if you think about emotional exhaustion and depersonalization and loss of a sense of personal accomplishment, it's kind of intuitive what would cause it. Long hours of work and overtime, a disrupted balance between your work and personal life. More so, I think, for physicians and nurses than most, this increased computerization of medical care delivery that, we look at our kids and say, hey, that's too much screen time. If they looked at us, they'd say, are you kidding me? Look at your screen time. If you compare how much time we spent face-to-face with patients versus a screen, it's absolutely incredible. And in fact, I feel very fortunate to be at Sentara, because I can go into my clinic and sit with my patient and then get out and do my screen work. Whereas other organizations I was in, they say, you do it at the same time, and you go in, and in front of you, there's a patient and a screen. And I cannot imagine what it's like for a patient who's used to sitting and talking with a physician in different settings to now come in and have the physician looking at them half the time and looking at a screen half the time. I can't imagine what that must do to people and what they must think about what's happening in healthcare. There's also a preponderance of non-patient care bureaucratic tasks. And I found that I took a quote from a nurse who, in tears literally one day on a unit that I was a medical director for, just, frustrated and saying, I didn't go into nursing to sit at a typewriter. I went into nursing because I wanted to sit with patients and hold their hands and take care of them. And I'm relegated to typing most of my day. So what increases the risk? For physicians anyways, the work hours, for every 3% For every additional hour worked a week, there was a 3% increased risk of burnout. For every additional night or weekend on call, there was a 3 to 9% increase. You can read all of these, the time spent at home on work-related tasks. In other words, you get home at night and instead of literally, figuratively dropping the briefcase down and taking the coat off and being with family, many physicians now do their medical records at home at night. And for each hour a week that they do that, there's a 2% increased risk of burnout. And obviously, these dramatically escalate when there's conflict at home. And interestingly, I found this fascinating, that doctors who are on an incentive pay structure end up having increased burnout. So, in other words, incentive pay means you get paid more for working more, and they have increased burnout. Why would that be? You'd think, well, maybe money would mollify some of this and make it easier to take. Well, the reason is that, when you have a family and you've got expenses and you've got, kids in college and all, you need to make more money. There's a pressure for it. And one way to make more is to work harder. And people that are experiencing some burnout, the last thing they should be doing is working harder. Your tank gets even more empty. You get even more exhausted. So for many, these incentive pay structures aren't the way to get out of it. And I think it's intuitively you think, yeah, just give somebody some more money and then make them happier. Well, the idea that money doesn't give you love, money doesn't make you happy is shown in the statistics here. So I want to talk about some kind of neat things that have been done looking at burnout in healthcare workers. I find this stuff fascinating. I hope you're not asleep by now, but I find this stuff to be absolutely amazing and what contributes to it. There are 3 things: gaps, imbalances, and individual characteristics. So gaps are really the gaps in what, for instance, the job's going to be and what it actually turns out to be. You go into nursing because you like taking care of people. You like being with people. You like to be in a healing role. And instead of having the art of nursing and laying on of hands, we're given, 100 different policies on how we're going to interact with people. You want autonomy. You want to be able to walk around, have 6, 7 patients on your list and be able to go in and give them what they need. But instead, you're told you have to make hourly rounds. You have to walk in them every hour. You have the 4 Ps. You have things that on paper seem to be a good idea and work well. But in many ways, it does rob us of our autonomy, which for many people is the driving force for getting them into healthcare. There are gaps in what you need, sleep, time to eat, time with your family, and what you actually have. And finally, one that I have found fascinating that was theorized by a guy named Daniel Pink, who's a social psychologist, is that, we have people in medicine who are trained for heuristic skills and they're performing algorithmic work. Well, what does that mean? Heuristic tasks are those in which the worker has to experiment with possibilities and devise a novel solution. Your patient suddenly drops their pressure, feels some chest pain or feels some leg pain, and you've got to figure out what's going on. You get into a problem-solving mode. You get into a diagnostic mode, and we love doing that. That's what we're in healthcare for. We're there to help people with our minds and our hands, and that's why people go into healthcare and stay in it. Unfortunately, healthcare, particularly for physicians lately, and I think for nursing to a degree, has become more algorithmic. You sort of follow a set of established instructions. Dan Pink says algorithmic work is like working on an assembly line. You come in, you got 8 hours, you punch in, you have to do the same task over and over again, and you get rewarded for it, and you go home. You don't require any creativity, and many people like that. Many people like algorithmic tasks. They want to know what to do, how to do it, and just go about it. But people who tend to gravitate to medicine and healthcare with these decision-making abilities want to do that kind of work. And I thought it was summed up nicely by this fellow, Dr. Schneck, who is out of Chicago. He wrote an article, and he said, and it's something that really caught my eye. We take people who are highly trained, highly educated individuals, both in nursing and technical work and in physicians. They're selected because of their motivations in terms of humanism, their ability to learn a lot of material, and we turn them into highly educated factory workers. We say to them, how many patients did you see today? How many patients did you round on? How many procedures have you done? Have you met your quality metrics? And it really robs a lot of this joy of medicine. I'm not saying that we can't coexist with this, but for people that really thrive on a decision-making platform that want to do a lot of good with their mind, it can be a real challenge. And so Maslow had talked about work-life gaps, and she designed 6 of those when she talked about burnout. The things that we like to have. We like to have control over what we do. We like to get rewarded for our work. We want to make sure that the organization has the same values as us. We want to feel fairness. I think fairness is huge. Fairness is one thing that will drive people away from a job faster than anything else. Am I being treated fairly? Am I being treated equitably to everybody else? Is it a supportive work environment? Is it a community here at the hospital? Do I feel like I belong here? And then the workload, is there enough work for me, or is there too little work for me? Am I being asked to do too much or too little? And Maslow talks about these and the relationship for physicians, and I think applicable for all healthcare workers. For control now, we have an employed model which by nature removes autonomy. In terms of reward, for physicians anyways, reimbursements are declining. Salary is dependent on productivity. I think in nursing sometimes, you have, productivity incentives and bonuses, and those are sometimes withheld. Are the values that I have, in concert with the place I work, or are they diverging? Sometimes I think as physicians we see administration unfairly, which is just a perception. I don't know that it's designed that way, but they're interested in finances, not patient care. I've never met an administrator in a hospital who isn't interested in patient care, but sometimes physicians, particularly as they get more burned out, will just say they don't care about patients, they just care about money, which isn't true, but it's the perception that people get. In terms of fairness, it may rise with salary and call schedule, comparing yourself to others. You tend to get a little greater distance from others at work. So all of these gaps tend to play into each other and produce an environment in which burnout can really thrive. Then we look at imbalance, and I find these to be just really interesting. So if you look at the imbalance between the demand your job has and the personal resources that you have to do the job. I mean, how many of us have at times been asked to do things that we may not just be capable of doing? And, that can be very threatening. The demands of the job versus the tangible resources. Do we have the equipment and supplies that we need to do the job? I think during the pandemic, the PPE shortage really set people off a little bit, and made people feel they may be at risk. And then the demands of the job versus your level of control over it. This is a theory that was brought up by a guy named Karasek in the 1970s. And he developed what he called the job demand control model, which I thought was really neat. So he talks about an imbalance between what the job demands and your level of control over it. When you've got really low job demands over here and very little control over how you do your job, if you're happy doing that, assembly line work, passive work, that's good. Many people are pretty happy down in this area. The job demands aren't high, but you don't have much control, but it really doesn't matter because the demands aren't high, as opposed to up in this quadrant where the job demands are high, but you have a lot of control over it. These are really motivated people. They can develop new ways to do the job. They don't feel restricted by policies and procedures. And these are pretty healthy, active folks. They develop good behavioral patterns and they're pretty happy in their job. Up in here, where you have low job demands and a lot of control, that's a low strain job. There isn't a lot of demand on it, and any demands or stresses that come along you can control. I think the challenge we see down here is where we are in healthcare, that the job demands are very high, but the control over it is very low. And this is where you're at risk for psychological and physical stress. So the autonomy to organize and manage your workload, for instance, whether it's on the wards or for physicians, is low, and the job demands are very high. So we tend to end up in this area in high strain jobs. So when I mentioned before about those, the best jobs of 2011 or whatever, they look at the work environment. I think there was a gross false estimation of how great the work environment is, because I think in healthcare we're seeing more so that the work environment is driving a lot of burnout. There's also what was called the effort reward imbalance, and that's a pretty simple concept, and is a balance between high workload and very low rewards. I think the moniker is that we think we work harder and get paid the same, or work harder and even get paid less. And that imbalance can really produce constant stress and lead to burnout. And there are individual characteristics. Healthcare workers and people that gravitate to healthcare are those that want to be in the job. They have high self-expectations. The idea of being in medicine that you sacrifice for each other. I don't think I've heard of any other industry where there is something called mandatory overtime. There's the idea that people are just going to sacrifice for others and always wanting to please others and take care of people. And for some, it becomes all consuming. Work becomes a substitute for social life and family life and any meaningful activity. So, people that go into healthcare are by nature, and particularly medical students and physicians, they're by nature kind of setups for burnout. So what does correlate with burnout in healthcare workers in general and not just physicians? Well, the age and number of years in nursing are inversely proportional to the level of depersonalization and emotional exhaustion. That means the older you are, the longer you've been in it, the less of depersonalization and emotional exhaustion you'll experience. Why is that? Well, because younger people coming in have not yet developed these coping skills that we need for new and unexpected work situations like the pandemic, for instance. The number of hours worked was obviously associated with higher levels of exhaustion and depersonalization. Interestingly, though, the amount of overtime work was associated with it, but not if people volunteered to work overtime. And you'd think, why is that? You think it's just the sheer number of hours that you work. Well, a lot of it is the loss of autonomy. If you're told you have to work overtime or you're guilted into it, you're not ready for it. You haven't sort of arranged things at home and gotten things all set. Whereas if you have an opportunity to volunteer for the overtime, you say, I guess I can do it. You speak with your spouse or your significant other and say, I'm going to work a couple extra days this month, and you get it all set up, and you're willing to do it and go into it with some autonomy and saying, this is what I want to do. So volunteer to working overtime did not seem to contribute to burnout at all. So what's the impact of burnout on patients? Well, in physicians, we see more medical errors, lower quality of care, and interestingly, a lower rate of patient compliance with medication and activity recommendations. In nurses, higher rates of burnout lead to higher rates of patient mortality, higher rates of hospital transmitted infections, and for all caregivers, higher rates of burnout correlate with lower patient satisfaction ratings by up to 15%. The impact of burnout on providers themselves: for doctors, an increased likelihood of being involved in a malpractice suit. For all healthcare workers, greater dissatisfaction with work. Personal relationships aren't as good. Some develop substance abuse characteristics or even depression or suicide. So again, this is a physical and mental health issue for people working in healthcare. What's the impact of burnout on healthcare organizations? And I guess at the same time, why is it important? Well, it's important because, for instance, greater number of malpractice claims lead to less money, less revenue overall. Higher rates of absenteeism leads to lower productivity. And you can see here, for a 1-point increase in burnout, a 1-point drop in satisfaction on physician standpoint, there was a 30 to 40% decrease in productivity over the next 2 years. And obviously, people that are burned out get out. They get out of the profession sometimes. The average cost of replacing a physician, for instance, is two to three times more than their salary. So you'd think there'd be a lot of interest in preventing burnout, because if people get burned out and leave or get fired or quit, change careers, that's going to cost the organization a lot of money. And I think the toxic work environment that's caused by people coming to work energetic and enthusiastic and seeing people around them just totally dissatisfied and burned out leads to attrition. People end up leaving the organization and going to someplace better. So what do we do about this? What in healthcare organizations can they do to prevent and treat burnout? I think number one is to acknowledge the problem. Many organizations do this fascinating thing. We as physicians, I found the statistics amazing that something like there was a survey once on doctors, and I think they said something like, do you practice defensive medicine? And 1/3 of doctors said they do. But then they said, how many of your colleagues do? And they say, well, 80% do. Well, those numbers don't make sense. Why does everybody do it except for me? And I think that we see burnout in that way in healthcare organizations. Yes, it's a problem nationally, and it's a problem in other organizations, but not mine. It needs to be a priority for hospital leadership, and many organizations are appointing, for instance, a chief wellness officer, somebody who's not only going to make sure that that there's patient satisfaction, but there is provider satisfaction in terms of nursing, support staff, and physicians. You try to develop appropriate incentives. I mentioned a short while ago, paying people more or having them giving them productivity bonuses actually can be helpful in the short term, but it can worsen burnout by having people work longer and under more stress. Rather, some of the perks might be to give them flexibility in scheduling or paid time off so that they get a chance to recharge their batteries. Also, there's been increased interest. Fortunately, many organizations are ramping up their employee assistance programs, the EAPs, providing mental health services. Some are providing gymnasiums for folks to, go and burn off some steam, during the day and get on a treadmill if they want to, and providing resources for self-care like yoga and mindfulness and resiliency training. So a lot of efforts are being made in that regard. I think from doing a lot of reading and talking to other people on the country about this, there are some provocative ideas that don't go over well initially because they take a lot more work and a lot more money. One is redesigning our medical records. You know, we now have an EMR that isn't like a medical record. I'm old enough to remember that a medical record was a 3-ring binder with my name and the patient's name on the spine, and it had an area that you wrote notes in and you know, wrote some orders in, and that was about it. Medical records now can consume, you know, 4,000 pages for a 7-day admission. You know, I look through physicians' notes themselves, and it has every potassium listed since the time the patient came in the hospital and every single x-ray since the patient came in a single note, because we can do that. It becomes unwieldy to even gain information out of it. And for physicians, it can become a huge challenge, particularly those who don't know how to type. However, it has also become a quality assurance tool and a billing tool and an administrative tool, and almost not like a medical record anymore. And I know that gets a little edgy to talk about that, but I think part of the problem with our EMR is that it's become, we try to make it something for everybody rather than what it should be, which should be a communication tool between clinicians to take good care of patients. You know, physician notes, nursing notes, notes from physical therapy, so that we know how everyone's thinking and moving forward. And it doesn't have to include, you know, every single detail of every medication they're on every single day and every single note. I think we need to redesign work hours to meet the needs of patients and employees. It always puzzles me why we have pediatric clinics open during the day but not the night. You know, kids are supposed to actually do something called be in school, at least before the pandemic. And yet our offices are open while they're in school with only sort of a 2 or 3 hour window in the afternoon. That makes utterly no sense, you know, utterly no sense whatsoever. It's like opening a bank between midnight and 8 in the morning and only those hours. Well, people are sleeping, they're not going to go to the bank. People are working, they're not going to be able to go to their physician unless they take time off. And I think we need to sort of look at things and say, is there a better way to do this, a better way to redesign work hours? And also redesigning the work environment to allow people to master new tasks. We love doing that. People love to learn something new and master it. They love to have some autonomy and control over what they do for work. So I think there's a lot of things that organizations can do moving forward. And what can we do ourselves? Well, we can learn to become more resilient. We can, you know, practice mindfulness. For those that are really suffering burnout, personal counseling can be extremely helpful. And also, you know, sort of foster self-awareness. Why do we like being in medicine? What do we like to do? I was talking with someone on a job interview. Someone was interested in coming to the organization. And I think instead of, you know, asking, you know, what did you do for education? My kind of questions are, what do you like doing? What, at the end of a day that you come home and you feel like this is just the greatest job in the world, what'd you do that day? Well, you know, what did you connect with that made you feel this is a great profession to be in? Sometimes reflecting on a personal experience or a meaningful encounter. If I see a patient who talks about another doctor in just glowing terms, I'll make sure to hunt down that doctor and say, hey, by the way, I saw Mrs. So-and-so and she thinks she'll walk on water. You know, you see that doctor just like brighten up like, wow, that's wonderful. If I come out of a room on rounds and my patient says, I'll say, how was the night? Oh, it was wonderful. I had the best nurse I've ever had. I'll hunt that nurse down. And if she's already gone home or he's already gone home, I'll make sure the nurse manager lets that person know that this patient just thinks that was the best experience they've ever had, because that's important for us. That continues to fuel us. And I sort of will close this section of it by talking about what Christina Maslach says. You know, it's paradoxical that most interventions to alleviate burnout focus on individuals. So 80% of the solutions that have been forth on burnout have been about what individuals need to do. But the research suggests that situational organizational factors play a bigger role. We have good people going into healthcare, bright people, energetic folks, and we churn out, you know, burnout. And I think a lot of that is work environment. And yet paradoxically, the solutions that come out are primarily on, you know, what we need to do to get better at individuals rather than what we could do to change the work environment. Some of the barriers to solutions are denial. You know, physicians and healthcare workers believe, you know, 82% or 89% of surgeons believe their well-being is at or above average, including 70% with scores in the bottom 30%. So in other words, I think I'm doing great, but if you look at my scores, I'm not doing so great. Administrators, you know, 96% agreed that physician burnout is a moderate or serious problem in the country, but only half said it was a serious problem in their organization. This is that that conundrum that, everybody else has the problem except for me. And this is something that is a real barrier to dealing with it, because we don't see it as a big problem. And in healthcare, there's this sense of omnipotence. We are able to cure people and help people and save people. And certainly I don't need to be helped or saved or cured myself. This culture in medicine of what I call presenteeism, not missing a day of work ever. I used to brag that throughout my residency and my career, I've never missed a day of work. I thought that I wore that like a badge. That was, that's what's great about me. And I've gotten all rather than going home and taking care of myself. But that's the sort of the tradition and the culture in medicine, which is not healthy. So have any of these interventions worked? Many large organizations have appointed chief wellness officers, developed programs to prevent it. Some have upgraded their programs to address and treat it. But again, primarily individual interventions, and few have addressed the real elephants in the room. If you ask people what causes burnout in you, they will tell you it's the hours, it's the lack of autonomy, and it's the darn medical record. And yet we do very few things to change any of that at all. And there was headway being made. The National Academy of Medicine made it a priority. They were real leaders in addressing healthcare worker burnout. As of a couple years ago, there was a lot of discussion in Congress about what could be done, increased recognition of the problem. And then along came the pandemic, and that has changed things. And I want to just spend a couple minutes talking about what's happened that. So here's a survey that was done in Medscape just last year that asked physicians, has your burnout increased since COVID-19? 2/3 of physicians saying burnout now is more intense since the pandemic. How did it change our work in favor of becoming burned out? Well, number one, our capacity was overwhelmed. MASH units were being set up, 2 ICU patients in a room, or even on a vent. ORs became ICUs. Medical students who are really at a critical stage in life, thrown into the fray early in their careers and taking care of patients who die. And when you're a medical student, you're not expected to go and deal with dying patients exclusively, and yet they were thrown into the fray early on. We were facing longer hours, shorter staffed, as our fellow employees became sick with the virus. We had sicker patients who deteriorated quickly, and we couldn't do anything about it. Our ICUs, I'd walk through the ICU every day, and you look and see, they were losing at times a patient a day. What does that do to the psyche of the nursing and the physician staff in an ICU when you're losing a patient a day and not being able to help them, putting them prone, increasing the PEEP, whatever you do, and they just die from this problem. Fortunately, we've developed other modalities of treatments which have helped a tremendous amount, and that curve has sort of been shifted a little bit. But interestingly, our jobs became safety issues for our families. I thought it was interesting that I make it a point of never wearing scrubs outside of work. I just think it's as a surgeon, I'm in scrubs all day. I should walk out of the hospital without scrubs. But I came in one day and, for one reason or other, just didn't have the clothes to wear home. So I ended up wearing scrubs, and I stopped by Kroger's on the way, and I've never seen the waters part as much as in March of last year, walking through Kroger's in scrubs. I could empty an aisle quickly by just appearing at one end of it. People would look at it and go, oh my word, because they saw healthcare workers as potential spreaders of the virus. And we were potentially bringing it home to our families. You can imagine the impact that had on healthcare workers. And our jobs became safety issues for us. Healthcare workers had 3 times greater risk of getting the virus early on in the pandemic. And interestingly, we're getting sicker. I should say the virus was affecting people and making them sicker when they were healthcare workers early on. And the reason was that the viral load was so high that they were, interacting with patients one-on-one and really getting tremendous exposure to a greater virus burden. The CDC estimates that about 1,300 deaths in healthcare workers, but others have pegged that as high as over 3,000. So this became an issue for us as individuals. And it led to emotional exhaustion, difficulty sleeping, physical exhaustion, a lot of eating disturbances, people either with a loss of appetite or as we get more fatigued, we eat more and gaining weight. And also compassion fatigue. People were unable to be empathetic with patients. They weren't able to connect with patients as well. Some of the tangible stresses that were there were just lack of a ready available testing services. We would have an exposure and we'd worry, do I have this? Am I bringing this home? And yet we couldn't sort of drop by and get a test before we went home. There was an inability to even get tested for it. There was lack of adequate PPE early on, as we all experienced. Reusing some of the N95s, which we had to do. Not so much. I didn't experience here reusing gowns, but they were, in New York City at some of the hospitals, they were reusing gowns. They couldn't keep up with the needs in terms of physical equipment. There was also a lack of understanding as to how the virus impacted the body. We didn't know what we were doing in healthcare. We didn't know what was going on. Why were so many people having a problem with myocarditis, for instance? And there were a lack of effective treatments. So this was a huge stress to people working on the front lines in healthcare when the pandemic came along. This survey looked and asked people, have you treated patients without having appropriate PE because it wasn't available? 1/4 of those polled in the United States said yes, that was the case. And in Spain, 2/3, because it was just, it just overwhelmed that country early on. You can imagine doing that, having to go in and take care of a person, not knowing that you were being adequately protected from getting the disease. The intangible stresses were caring for patients and families. In a community, you are working in a hospital, and once in a while you might see someone that you know in the neighborhood. But when we had such a huge burden of patients coming in, there were many times that you were taking care of folks that and in many cases watching them die. Families being unable to come in, particularly at death, the nurse sort of filling the role of being the family sitting at bedside for the person. We were seeing fellow healthcare workers get sick. And then there was this sort of moral injury that people talk about, that we felt helpless to do what we've been trained to do, what we expect ourselves to do. People come into the ICU and we make them better and they go home. And now they're coming into the ICU and they're dying, like I said, one a day at times. And that just had devastating effects on this sort of this sense of personal accomplishment. Am I actually doing the right thing? Am I doing what I've been trained to do? I won't go through all of these. These are just comments. The worst time in my life ever, both personally and professionally. I was infected. I had to self-isolate. I'm quitting my job, going to focus on my own health. So if you look at the top 10 stressors, and this is excluding physicians in this survey that they did of healthcare workers, what were the top 10 stressors? And as you look at them, most of them, the vast majority, had to do with work. Fear of getting it, long hours and shifts, fear of spreading it themselves to family members, lack of job security. With all the elective surgeries canceled, is the hospital going to actually lay people off? Conflicts with coworkers. You look at these, the election, the general state of the world, family responsibilities, these were included. But if you look at the top 10 stressors that people were facing, healthcare workers, it was all about work. And the impact on mental health was incredible. They've already have studies that have looked and said that almost half of the people reported, that healthcare workers reported their mental health was worse than it was the year before. Half admitted to crying at work at some point, but only 12% started psychotherapy to help them cope with their work-related stresses. Again, the barriers being that we're the healers, not the patients ourselves. Sleep deprivation was incredible. 86% getting 7 hours or less, which we need 8 hours or more, and almost a third getting 4 hours or less of sleep at night. This is just a setup for burnout. And a dramatic impact on work performance, about a third feeling like they're making more mistakes at work. And one half, think of that, one half of people considered retiring, quitting, or changing their careers. If you think about that, 50% of people that were surveyed in this said, I'm either getting out of it, I'm retiring, I'm quitting, I'm just going to get out of the field altogether. That's just incredible. I can tell you that when they surveyed physicians about 5-6 years ago, only about 20% said they are thinking about retiring, quitting, or changing because of burnout. And this is, dramatically increased. So who are the most impacted? Unfortunately, female healthcare workers, 50% felt worse about their mental health versus only 36% of men. 54% admitted to crying at work versus about 20% of men, and about half thought about leaving their jobs versus a lower percentage in men. And older healthcare workers, 48% of all respondents felt worse mental health care, but those over 45, 52%, those over 60, nearly 2/3 felt worse mental health. And again, those over 60, over 60, 70% thinking of quitting, changing careers, or getting out of it altogether. This just reflects that retiring early. If you think about this, you think all the reasons what has impacted a different work setting, a different type of work. You look at the last one, about 50% didn't think about doing something different, which again, I think is just tragic moving forward. So what did we learn from the pandemic? I think we learned a lot. We learned that we can learn on the fly. We can turn the tide and we can start saving lives. If you think about, if you were involved deeply with patient care back in March and April, we were not doing a good job. This virus was overwhelming our ability to take care of patients. Now, if you look at the curves, especially with the last couple of months, not so much the last 2 weeks, but the last couple of months, cases are skyrocketing, whether it be for the new variants or whatever. People blame the Super Bowl, name it. But the rates were skyrocketing, but the mortality rate was going down. So we have more people sick with it and fewer mortalities because we are making a difference now in healthcare. We found the essential need for teamwork and buddies, one person goes to the room, the other person is circulating outside in the ICU, helping them out. We can provide care and be safe for our families at the same time. And I think more importantly, the more facts we had, the less fear we had about it. And overall, we responded to an incredible challenge. This is a once in a lifetime event, if you think about it. Those of you old enough to have lived through 9/11 as an adult realize that was just an event that none of us will ever live through. This pandemic's the same way. This has changed the way we address the world, and healthcare workers are on the front line of this. So how should we respond? We need to watch for signs of burnout in our teammates. Watch for people who are getting out of work a lot, but be careful. Sometimes staying away from work can actually be healthy to decrease the stresses, to recharge the batteries, get rid of the exhaustion. Watch out for mental mistakes and overt fatigue. These are signs of burnout. Emotional extremes, I talked about these earlier. And don't be afraid to approach someone about it. Share your experiences and feelings. I've approached more docs than I can tell you. I think they think I'm a thorn in their side, but it's just to say, how you doing? Oh, I'm good. I saw this patient. I don't know about the patient. How are you doing? What's going on? How's the family? How's your health? We were all worried about, could we catch the virus? Well, these are real feelings. And most of all, appreciate your role in the community. People see healthcare workers as heroes in this, and they are. But be humbled by that and realize that what difference we made in this. That people are actually looking at this hospital and saying, I don't want to go near that place. That's where you can catch it. But aren't we blessed to have those workers go in every day into that environment and save lives? And be positive, because we'll get through this, obviously. But we will be better prepared next time when it does hit, because it will. We're looking at the future where these things could happen again. What else should you do? Develop strong interpersonal relationships, set boundaries between work and personal life. Recognize that this is my work time, this is my personal time. They don't necessarily have to collide. And take care of your own health. Get enough sleep, nutrition. These are basic things, but we tend to neglect them in our drive to take care of others and be sacrificing for others. And as I just said, be appreciative of what you have done, what we've done, and what we can do as a team. I guess finally, the thing is, what can you do on a day-to-day basis? If you need fewer hours, talk to your supervisor about it. If you need time off, take some time off. Identify what your own signs of burnout might be, because again, the switch doesn't go on and off, and you're not suddenly burned out and that's it, or you're never burned out. There are times that we all stick our toes in the burnout waters and yank them out quickly, or sometimes spend a little too much time in there. Identify what your own signs are, and notice in your own self when the wires start to tighten a little bit. Maintain basic self-care in terms of nutrition, exercise, and sleep. Use your time wisely. Stay active. Don't get home from work and lie on the couch and say, well, I'm done that day. Be active, get out, get exercise and get enough sleep. Adopt stress reduction strategies if those are helpful for you: deep breathing, yoga, meditation. Interact with your colleagues, understand each other, make time for peer connections. Don't become introverted. Connect with a friend or family member for quality time. It's not just sort of showing up or making a quick phone call, or as my kids do, text them. Call them, talk with them, and interact with someone. And if you need it, check in with a therapist. There's nothing to be ashamed of with that. We always have this stigma that our health is supposed to be perfect, and if we had a heart attack, we wouldn't stay at home and say, oh, I don't want to go to the doctor. But if we have some mental stresses, why do we stay at home and not say, I need to talk to a therapist? And recognize your own vulnerability and your need to be well for self and others. So just in closing thoughts, I pulled this comic out once. How's it feel to be the hardest working employee in the hospital? Tired, sore, exhausted, sick, stressed out, and lonely. And this guy says, well, you probably don't know how good it feels to be useless. We are all in this category here. where we are working hard and we want to be useful for people, but it can have its downside. Ty Schonefeld said, which I thought to be just so impressive, until now, only bandages have been applied to address the problem. Stress management, resiliency workshop, teaching mindfulness to individual physicians. We tell physicians, get more sleep, eat more granola, do yoga, take better care of yourself. These efforts are well-intentioned. The message, though, is that you're the problem and you need to toughen up. We need to stop blaming individuals and treat physician burnout as a system issue. We need to treat it as a system issue. It affects half our physicians, and because of that, it's affecting half our patients. And me, MD, I say the vast majority of solutions for preventing it and treating it on focusing on what the individual can and should do rather than changing the environment. Burnout is not the result of people with underlying problems that are exacerbated by their work environment. It's the result of good people with noble characteristics that, ironically, though unintentionally, is designed to encourage burnout tendencies in the group. So finally, remember who you are and how you got here. Physics wasn't easy. Chemistry was worse. Think back to some of those times in school and how hard that was. Time away from family was tough. Being on the bottom rung wasn't pleasant. But you did it for the highest calling of all. You did it to help others in their greatest time of need, because, in their eyes and in your mirror, what you should see is what they see. They see this. They see that, you have come through in a most difficult time and have made the world better, and not being trite about it. You've made the world better. You've helped people to get through this. So recognize that and value that in yourself. I hope this has been helpful. It's been fun to talk to you. I wish I could have done it in person, but hope you enjoyed it.